Hi everyone, I am Dr. Jackie the PA. Welcome to my channel. If this is the first time you're on my channel, I welcome you. I hope you find something that you like, something that's interesting, where you like, comment, and subscribe, all that jazz. And if you are a returning viewer, I say this every single time because I mean it from the bottom of my heart. You are the real MVP. And that's because you didn't even have to come on my channel to watch anything else, especially with my lack of consistency, but you did and you're here. So I decided that I wanted to go in a little bit more detail about my transition from working as a PA in a clinical setting and then going to become a medical science liaison. So just a little background. So I am at a hotel. I am at a conference in Nashville, and I have some downtime right now. I'm actually going to be doing some work, but I figure this is a nice time to kind of explain my transition, offer any tips that I think may be relevant to a PA that is pursuing or wants to go down that medical science liaison route. It may be applicable to anyone. I do want to leave a little disclaimer. I always find myself getting into positions probably in a non-traditional type route, meaning I don't think there's a standard. I think everybody that I know so far who has gotten an industry job has had a different route that has been unique to them. So I'm not going to say that the way that I got into this industry is the standard, okay? It's just for you to open up your mind and just not limit yourself as to where you can go, what you can do, and what you cannot do, all right? So first, for those of you who have never watched anything that I've posted before, and this is your very first time watching me, I am a doctoral educated PA. I earned my doctorate in medical science degree last June from A.T. Still University. I have worked as a PA for 11 years in a variety of settings, including neurosurgery, emergency medicine, urology, urgent care, occupational medicine. I know, I got around. I like to say I'm the jack of all trades. Prior to becoming a PA, I worked as a registered nurse. So in total, I've spent 20 years working in healthcare, over 20 years. My entire adult life has been nothing but working in healthcare. And I've interacted with doctors and providers from all different backgrounds, the difficult, hard to work with people and the easygoing people, all of that jazz. I've worked on the hospital side, the clinical, the outpatient clinical setting. Your girl's been around, okay? So, I worked during the pandemic in occupational medicine, and for me, I felt the burnout going up a notch. I originally went to go get my doctorate degree because I knew that I wanted to do something that was not necessarily at the bedside. I did not go to get my doctorates with the intention of becoming a medical science liaison. I thought maybe I would work in administration, health policy. I wanted to just work on the opposite side of medicine where I felt like I was going to be making a different type of change, okay? And I actually posted it's a PA doctorates group on Facebook, and I posted, how can I become a medical science liaison? Because in all honesty, when I knew that I was going to transition out of direct patient care, I was applying to faculty positions, but no one was calling me back, But anyhow, no one was calling me back. I applied to faculty positions, but I also I saw a lot of people talking about being a medical science liaison, and I just started asking questions. So some of the questions I asked people was hey, tell me about your job. What is it that you like about your job? Everybody seemed to be happy and loved what they were doing. And it kind of reminds me of how I got into becoming a PA from a nurse. I asked actual PAs and I asked physicians, did they enjoy what they did, and what would they recommend for me? What is it that they enjoy most, and would they do it over, or would you choose to become a physician versus a PA, or vice versa? So I try to gather information. So I did the same thing about medical science liaison. And until you're in it, you don't really know. It's kind of hard to really explain it in a more succinct way than how I typically explain it right now. And some of that may be just because I'm newer. But anyhow, so I put this message out, and people left like suggestions, recommendations. There was one person who actually left the name of a PA who was a medical science liaison and told me to connect with them. And they're like, yeah, connect with me on LinkedIn. So me being me, I find them on LinkedIn because y'all know I love my social media. And then I kind of like go through my whole spiel as to, I'm telling her basically my entire life story as to like, this is where I think I want to move into, like I'm gonna move into this type of role. Just tell me what steps you would recommend me doing. I did not go in with the intention thinking like, okay, this person was going to be the person that would hire me like 6 months down the road. I just kind of share my story, my motivation, my ambitions, and I also have the credentials on paper, so I think that was helpful. So after we like connected, we talked about life and realized that we had so much more in common, just in general outside of working. And I was basically told that when a position opened up, she wanted to be able to hire me. And I was like, yeah, because I was thinking, just because I've lived life, y'all, and I just was like, well, who knows when a position is going to open? Because I was doing my research and people who were looking for MSL positions were looking for a long time. Not that it's just like it's competitive. It's a competitive field. So a lot of the medical science liaisons that people commonly are going to come across, because you traditionally think of medical science liaison in industry and you think drugs. So for working for a pharma company, a lot of them are pharmacists, which make a lot of sense. They'll be able to tell you a lot about the drugs. I actually work for a lung cancer diagnostic company, and we talk a lot about clinical utility. And to really get a strong grasp on clinical utility, you definitely have to, I think that clinical background helps. And she had this vision for a team of clinicians that were doctoral trained and could speak to the clinical utility of a test, have an understanding of how the actual hospital day, clinic day, surgical day can go for a provider, and then talk about how this test is going to be beneficial to the patient as well as to the provider, what the data looks like, what the science looks like behind this particular diagnostic test. So I was like, okay, cool. I had to give 120-day notice from my job, which is a long time. Y'all feel like I was a prisoner. And I started working for this company in April of this year. So one of the hardest adjustments has been just switching your brain from that clinical, almost rigid type of mindset, or way of doing things. I can't say it's mindset. I feel like I have an adaptable and open mindset. It's more so like you're doing a certain thing between a certain time, and I'm getting patients in and out. I have this much of a window. I need to address these top issues, and I need to make sure that they're happy, that they're adherent to the recommendations, and that they come back for follow-up. Like that's kind of how that went for medicine. And then with this job, I had to like get rid of some of that rigidity, because if you ask me what is a typical day is going to look differently depending on the day. Like literally every day can be different, and things can change in a matter of a day, a few days, depending on what you're doing. So for example, this is being recorded on a Saturday, and that's because I'm at this conference that goes through today. And then Sunday I'll fly back home. Monday, I got to look at my calendar, but I believe I have some meetings, but I'm flying back out on Tuesday to New York, and then having a dinner. So I said I'm going to be trying to share more of what like a day looks like, because I can't say it's a typical day. An typical day may be the most accurate way to describe what it is for me. So I would say the best things I like so far is that it's definitely, it's not the same. Every day is different. I like being able to talk to people and socialize. Now, I feel like I'm unique because I don't like to fit in a box. I like to be able to still bring my real authentic self, knowing that I have the credentials and everything to back it up, but I want to be able to talk to you like a regular person, like a regular human. And even when it comes to the science, like break it down into a regular human type of utilizing way, I guess is the best way I want to put it. because at the end of the day, what a doctor wants to know is like, okay, what is it that you need from me? How much work I got to really do in order to incorporate this test? Does this test work, and is it going to help me and my patient? Well, it's going to help the patient first, because the patient is at the center of it all. So that's what they care about, and I still care about that too. So, um, any tips that I would have right now, because I don't want the video to be super long. I want you to be able to like wash dishes and then do this, or fold some laundry and listen to this in the background. But I think I talked about my transition, what I like so far. The only thing I don't like is that I'm so hard on myself, and this is completely honest. Like, I have these high expectations, and even though at this job they told me you will not feel as comfortable as you're going to be until like a year has passed. And I'm like, I want to know everything right now. Why am I not a genius? Why is this not just rubbing off on me? And I want to, it's just, there's so much. There's so much. There's so much, y'all. It's so much, but in a good way. So if you like to like challenge your brain, you got to find this is a good step. I would say, if I had to leave, I don't know how many tips I want to leave, but I'm just going to start off with some tips that I think are helpful if you want to get into industry, okay? So I got to remember, like, around 11 minutes is where I get into the tips. Number one, sometimes it's just a matter of networking. That's not going to be all the time, but I think it is very helpful for anybody who is trying to pursue this role. So hop on LinkedIn, Facebook, find the groups, connect with the Medical Science Liaison Society, and that's just so that you can connect with people who are in the industry, because I know so many people who got a job because they knew somebody else, or they were part of like the MSL Society and attended something, connected with people, and then those people who were already working in industry recommended that person for that job, and that's how they got in. So it's always going to be important to know people in high places who can do things. All right. So be connected. Two, have grace with those people you are connected with, because I'm just speaking from my personal experience, and I definitely want to be able to send this message and reach out to as many people as possible and help them, get in, as if that's what they want to do. But have some patience and grace, because sometimes messages are considered delayed in answering. It's not that they go unanswered, but delayed, and you can't like probably give as much individual time to every single person when they want it. It happens, just probably not in their time frame. So I'm just going to say, like, have some grace. Understand that, like, for me, I'm still learning a lot about my job. I'm also traveling, and then I'm a wife and a mom and a pageant queen at the same time, y'all. So y'all know there's that. And then I'm trying to like work out so I can like grow into my, before 40 body. I got 10 more months. But anyhow, there's that. So have grace. Number three, I would say, kind of like look at job descriptions and see where you may have strengths, but also where you may need to improve. And that can be a different thing for every different person. And I guess this is probably breaking these, tip number three down to like sub tips, but like having that clinical experience or having years of experience in medicine is going to be very helpful. If you have only been working in medicine 2 to 3 years, transition into an industry role may not come as easily. I don't like to think that things are not impossible. It's just that oftentimes these companies want you to have a lot of experience, and that's those things when you think of like a scale and you're weighing out and measuring against other competitors for that position. If you have 2 years of experience and they have like 15, that person moves up, so consider that. Having a doctorate degree is helpful. It is not an absolute. There are excellent medical science liaisons that do not have a doctorate degree. But right now, in how competitive it is when a job is posted, and just listening to other people who have tried to get an MSL position, sometimes it comes down to who has the doctorates and who does not. Or I always like to say, like, everybody who applies to these positions, most of them are going to be highly qualified, and then now we're just splitting hairs as to like what's going to be that different thing that makes you stand out. I would say be interpersonal, have a personality. You got to realize that you are interacting with people who interact with other people all the time, all day, and don't bore them. They're not trying to be bored. You want to be professional. Like, I feel like I have like this big personality. I like to bring energy and bring my little, I don't know, my little Jackie stuff. But I like to make sure I'm professional. You're not catching me out here cussing casually or getting all touchy feely, none of that. Breaking it down into like, I don't know. I talk like, this is how I talk when I'm talking with physicians too, or healthcare providers or other professionals. I like to talk. This is because this is how I really talk every single day. But it's something extra. Like, know you're something extra and work that something extra. I'm not telling you how to be, just, you know what I mean. You know what I mean. Professionally, you're a professional extra. Let's see. I think I'm on number 4, but I could be lost. I was talking about sub tips, and then I'm like, I think I'm on tip number 4. Tip number 4 would be persistent on your journey in pursuing an MSL career. I have heard numerous times that it takes years for people to break into industry. And again, MSLs are going to have a variety of backgrounds. So you can have pharmacists, physicians, nurses, nurse practitioners, PAs. So a variety of backgrounds. So you're competing against that entire realm. I would also say read scientific articles just so that it becomes second nature to you. And the reason I mention that is because you may think it is not as important, but you're going to be reading a lot of articles if you are a medical science liaison, because there's always new information, new clinical studies, clinical trials. You're going to have a stack of papers that you need to be familiar with when you start depending on the drug, the technology, the company. So yes, become familiar with that. I would also say have an open mind, be flexible. So sometimes opportunities present themselves, but you are not as open to the opportunity as you may think. And I'm going to use this as a perfect example. So like I said, I did not have the most traditional route. I really just built up a relationship, had the credentials, and I have a personality, and, you know, pass my presentation. I call it pass the presentation because you have to make the scientific presentation and present it to these people, which is the most nerve-wracking thing I did because I did it in the middle of clinic at my last job. But anyhow, I would say, so I kind of forgot what I was talking about, but then it came back to me. But so when I took this job, I was hired to be an MSL in a totally different part of the country. And I was like, wow, like, it's hard to get into this industry. I'm going to take that position. I'm going to take this. I'm going to plead the case to my husband. I'm like, listen, this is like one of those opportunities. I got to get in while I can get in. And then, you know, something pops up. We don't have to think about moving. But I was willing to move to get into industry in this job. And some people say they want things. This is just my own personal thing. Some people say they want things, but they're not willing to do what it takes to get the thing that they say they want. So I was like, well, I'm willing to move. I think the opportunity was worth it. The money was worth it. And, you know, things can change. And I wanted to move out the city anyway. And then the way the universe and God and all my ancestors talked to each other and everything played out, I ended up not even having to move, which worked out well when you think about some of the things I was going to have to sacrifice for the job. But so I say all that to say, keep an open mind and really think about, is this something you really want? And I'm like that with anything. So I think if there's anything you really desire, anything you really want, there's going to be a hard associated with it. Be willing to do that hard. Or I'm big on that whole short-term pain for long-term gain. So I may have had a couple of years of hardship, But in the end, I was going to like, man, listen, in 5 years, I'm about to be a vice president or something. I don't know if I want this whole, CEO type role yet. I don't know. We'll see. But I definitely will be vice president. I'm speaking that into existence right now. You heard it here first. But yeah, so make sure it is something that you really want. So yeah, be relentless in your pursuit of this profession. Have patience and have grace, and always remember that things happen how they're supposed to happen when they're supposed to happen. So you may have felt like this one particular job was for you, and then a different opportunity that was better fit for you came about. And make sure I got all the tips. All the tips. I think that was, have fun with it. Like, don't have fun with it. And yeah, I think that's it. I think that's it. I would love to hear any comments, questions, concerns. I want to make more videos about my journey. Like I said, I'm going to try and do an atypical typical day. As y'all follow me around for a hot second, little cliff note versions of my day, so that you can know what it is. But I'm hoping that this video is helpful. Again, I'm making this from my hotel room during a break because I figure people been asking and I want to answer, but sometimes I can't answer individually. So here's this video for you to refer to. Yes. Oh, check out there's podcasts, like MSL, I think, I don't know the exact name, but there's podcasts. I'm trying to drop the links below. Don't hold me to it if I forget. No, I'm going to do it. I'm going to do it. But yeah, just I wish you the best of luck, and then leave your questions so that I can answer them and make more videos. Okay. Lighting was good today too. All right. Bye, y'all.